Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. We have a very special episode here today. We have two people. Usually on Slice of Healthcare, we only have one, so we have two, which is pretty cool. Double the fun, right, is what that means. And we're going to focus on how to succeed with virtual care. Two special guests. We have the co-founder and CEO of Healee and the CTO of Perci Health. I'll let them both introduce themselves. Josif, we'll start with you, and then we'll kick it over to Paddy.
Thank you, Jared. Thanks for inviting me. I'm Josif. I'm one of the two co-founders of Healee, and I'm mostly in charge of anything that doesn't have to do with coding. Basically, I'm the business development slash sales slash product guy between me and my partner.
And then Paddy, you haven't been on the show before, so if you don't mind giving us your background, you're the CTO of Perci Health, but then also give us a quick overview of Perci Health, and we'll dive in.
Yeah, of course. So, firstly, thank you for inviting me to be on and talk about Percy. So, yeah, I'm Paddy Rehill and the CTO of Percy Health. Percy Health was our tagline. Really is no symptoms should go untreated, but that really is specifically on the cancer patients in the cancer space. So we have you can kind of describe a problem in two ways. There's a supply and a demand issue. So let's talk about the demand issue first. So in the UK, we're very lucky here to have one of the best healthcare systems in the world, and when it comes to cancer care and oncology, again, one of the best. And that sort of cancer pathway will end once you've been told. Hopefully, you have a conversation that says, "Congratulations, Mr. Smith. We're pleased to say that you're in remission, or you're now clear of cancer, and you no longer need to be in our care." And that's great news. But often, as you can expect, it doesn't take too much of an imagination to imagine. Look, the psychological, physical, and obviously practical issues that they're going through, right? And these are little things that go through every single day of their life, right? So as simple as, I'm eating meat. Is there too much protein in it? Is this protein going to cause my tumor to come back? Or I'm doing some exercise. I've got scars or surgery. Am I allowed to do this? Is this going to make things worse? There's the microtransactions of daily life that are affected. That there isn't good support for that. Basically, the NHS, we believe, doesn't do a good job of that, or if it does, it varies massively on where you are in the UK. So that kind of is like what we think is the demand problem, and then the supply problem is that we want to connect people to allied health professionals, people like dietitians, psychologists, physiotherapists, who can help address them aforementioned symptoms, physical, practical, and so on. But not with a specialism in oncology. So a dietitian who has a specialism in oncology, who understands the impacts of treatments that you would have gone through. They understand when they see your case file, they've had this type of diagnosis and this sort of treatment, and they have a very good understanding of what specific advice they can give within their profession, the best intervention that would help that person. So what we've done is basically try to democratize the access. So that's where the digital healthcare comes in to bring all that content and access online, and basically lower the barrier of entry, make it easier both from a access perspective, but also from a cost perspective as well. And so that, in a few sentences, is basically what we're trying to do. It's something that most people haven't seen, and that's a good thing. But if you have been through it, it's a massive impact, and we've had amazing feedback from many people that we've helped.
And so the initial focus, so your initial focus and want to start this company, what really led you to want to, dedicate so much of your time, your life to building out this company? And then I guess this is two parts. When you started this company, what were some of the early challenges, and then where did this relationship, which you're working with Healee, how did that come to be? And then we'll kick it over to Josif to talk more about how you're helping. that relationship?
Yeah, of course. Yeah. I think I think the best way to describe why we're doing this, or the impact we're doing this, is probably to summarize where we got our first round of investment. So I think the easiest way to kind of explain to anyone how much of a gap this is in the market is this: the top oncologists, cancer professionals in the UK were the ones that raised the first £1 million that went into Percy. So nothing says I believe that this is a gap than oncologists themselves, the people who are at the core of this, who understand this better than anyone, saying I am happy to part with my own money to see that this business has grown and that you can help these patients because they see them every day, and the gap is just unbelievable. And I hope that illustrates kind of the size of the problem, and that's why we want to help, and that's why I'm in the business. That's why we kind of exist. Our earliest challenges, I think, as most startups, is really we've got the demand. We're building the supply. Our co-founders have had an excellent network of professionals in the UK, but it was like, how do we actually create that sort of go-to-market strategy, right? How do we where's the payers, basically? In the UK, it's a public healthcare system, and so people aren't paying at the point of use. So it was around how to maintain the free access to the point of use, but obviously that there has to be a payer somewhere. And so we've gone down the kind of employer route, and that's worked really well for us at the moment. So, and we're continuing to expand that to hospitals and insurers, like income protection people. There's lots of parties that I want to support their clients in improving their lifestyle, returning to work, and things like that. So that still is a challenge, that kind of product market fit and the core strategy that we have. But I think that leads quite nicely into the solution and how we actually try to implement it. Is like, for me as CTO, I'm taking a step back and thinking, right, we have very limited resource in terms of time and money. We want to test the pathways, the experience. We want to really test and build that, not a booking platform or a scheduling platform or a messaging platform. That's not where the difference we're going to make. So that kind of quite early on in the journey of trying to find, well, how do we actually build this out? It was a natural solution to see, well, how can we find some platform that we can join into, or use some APIs that we can bunch together. There was lots of different options that we had, and then we came across Healee, who have their white label product, and so the synergies, hopefully from what I've described so far, are quite clear, right? So there's a white label solution that is a well-established platform doing thousands and thousands of appointments a day, and it's flexible, scalable, and customizable to the bits that we want to change, right? We don't want to change how scheduling works. We want to change the care that people get and the order in which they can see professionals, get the right information, and make themselves feel heard, but get the help that they need. That's the bit we want to add on top. That's the bit that makes us unique. And I would argue that that's actually where the industry should be going, and I think that's probably where it's previously gone wrong. And I can see this it's a bit of a slow motion car crash. I'm seeing other people making the same things. Like I do think the industry needs to switch over to bring what makes you unique. Don't just rebuild a healthcare platform that just does payments and bookings and things like that.
Well, Josif, that must warm your heart when you hear this is where the industry
Yes.
should go. Why would people want to do it some other way? Like, these are all the nice checks that I'm sure you like to hear. And you've probably seen, you've dealt with the problems that Paddy discussed, both internally, right? But externally, you hear these problems from these organizations that you work with. But talk us through, these problems that you're helping these digital health companies solve. I think Paddy alluded to many of them. And then just for this piece of it, right? Just how common are those early growth problems that Paddy was talking about, in terms of you have limited resource technically, talk us through like how often you see that situation with digital health companies.
Yes, as Paddy described, the process that they had gone through. It's fair to say that maybe 90% of a particular type of prospects and clients that come to us, it's fair to say that they have the same build or buy dilemma. Maybe they are a little further down the road. They have tried to either build something in-house, or this slow motion car crash that that Paddy mentioned, or maybe they have tried to patch together like a combination of point solutions, or maybe they did the research and they decided to actually buy and not build. But I think that this boils down the problem that we're solving, because at the point where when Perci Health came to us, at this point we already had the platform, our own platform, because we are in a way eating our own dog food, built out. We were already seeing massive traffic. I mean, that's the same technology, that's the same backbone that we provide to clients. It's powering our own platform. And of course, I mean, no software is ever 100% ready, but it's fair to say that at this point we had already figured out the basics. Like, okay, so if we divide it into scheduling, patient intake, and telehealth, this is what each of these components should include. This is the feature set that makes sense in terms of basics. And we just decided, based on the natural demand that we started to see, because of the way the platform was conceived, why don't we implement this, make it possible to have this white label approach, which would allow these all these clients to really focus on what they're good at, like the medical aspect, the patient journey, how they provide care, how they connect providers to patients, instead of trying to reinvent the wheel in a way. And of course, the other important aspect is that, yes, the basics are the same. So when it comes to scheduling, you have schedule, you have calendar. When it comes to telehealth, you have two parties, but then you have some differences from a therapeutic area to another, from a client to another. So we were striving to enable such enhancements and like really rearrange the blocks of care within each and every universe, or as we call them, replicas. But yeah, it all starts, regardless, by the way, of provider size and really even type. We are seeing the same thing with more traditional healthcare providers, like hospitals. They want to add a digital modality to their care delivery. So in a way, it is the same. Why use an EHR to do that? Why try to twist the internal workings of the calendar of the EHR when you can have the patient-facing scheduling that's built precisely for that? Yeah, that's how I would describe it.
And what's next for Perci, and how does this relationship continue to, I guess, evolve? What do you envision it looking like on your end, Paddy?
So we kind of alluded to earlier, we've really working with employers, but we want to open it up to insurers and hospitals and things like that. And as we get more integrated into larger partners, they want to have smoother entry points, smoother workflows, and it basically allows us to create a more customized journey for our users. Our internal kind of North Star is to create basically personalized, bespoke journeys for our customers, so that we're solving the problems they're bringing us, and we have the data to back up that people have come in like them, and we've given them the care they need on the platform. We've got evidence to show that we can that we can help them. And so it's the convergence of two, the entry points and actually how we want to personalize on the platform is kind of where we want to head. And we're doing that by basically enhancing the product more and more and more. And that happens through kind of two ways. One is actually a lot of the design and development function happens internally at Perci, and we have a really great relationship with Healee, who can actually develop these changes. But where I see that kind of moving is basically opening up basically more of the platform so that we can bring some of our resources in to work on the stuff that's very specific to us. And basically the continuing development of customization and the development of greater APIs and more a maturity of the framework, essentially of the Healee framework, to allow us to do more and more personalized specific journeys through the platform.
And I guess in these future growth plans, as you're expanding, Josif, what is your favorite part about working with companies like Perci? I mean, you get to see them grow. I'm sure that's one of the cool parts, but and also you get to see some big impacts, right? What excites you about Perci moving forward?
By far, what has been very exciting and basically very, very helpful and refreshing compared to other cases and other clients that we've had and we're having is the fact that we have a counterpart in the face of Paddy, in the face of the wider team, because as Paddy just described. The process of enhancing the product inevitably, and this is something that we will be trying to change and improve, but inevitably involves us sitting down, understanding the business need, understanding the designs that they provide, and basically developing these enhancements. So it's invaluable when you have a counterpart who would know us a thing or two, not just about the medical aspect of things, but basically about how software development works. So this is really something that's been very, very, very important. And to what Paddy just mentioned, obviously with the more and more enhancements will be needed. More and more workflows we would need to accommodate. So we are trying to make it to enable Perci, and not just Perci, but clients as a whole, to bring in their own dev resources. We're opening up the APIs, adding more and more endpoints, and even making it possible for each and every particular client to extend, to have a setup where they can extend the feature set themselves, because this is a viable way to really scale scale the platform in a meaningful fashion.
Well, I want to thank you both once again for joining me here on the podcast today, sharing your story, talking about how you're working together, how you're growing together, I should say, not just working together. And wish you both the best of luck. We'll continue to follow up with what you're both building, where you're at, and hopefully we can have you on the show again in the near future.
Brilliant. Thank you.
Thank you, Jared. Thanks for having us.